Good morning and welcome to Healthy Communities. This morning we have Dr. Bina. I love that name. Good morning, doctor.
Good morning.
So what are we talking about today?
We're talking about colorectal cancer screening and prevention. This is in March. We have the Colorectal Cancer Awareness Month. So I would like to inform our listeners about their options.
Okay. So first off, when do we have to begin this?
Depending on the personal history, if there's no risk factors, this should start at age 50, and for African American people should start at age 45.
At 45. Well, I'm not African American and I'm not 50, but my doctor told me that I should probably go get one because I started getting paranoid because people around my age are starting to get weird sicknesses. So I thought, what can we do to prevent this? So it's better to be safe than sorry, right?
Absolutely. We need to look for it. Most colon cancers do not give any signs until it's too late. So most of the symptoms are nonspecific as well. By the time you have bleeding or signs of blockage, it's usually a very advanced cancer.
Really bad. Okay, so it's a good idea to get on this thing early.
Absolutely.
All right, how intense is it? Just try not to scare me, but let's say I'm going in next week to go get one of these. What's it all about?
Well, most unpleasant part, as far as my patients are telling me, is the preparation before the colonoscopy. And this is a very important step because it will assure that the colon is clean and I will be able to see all the lesions, polyps that are actually where the cancer starts. So majority of colon cancers start from growths called polyps. And if we remove these, we basically prevent the cancer from forming.
So you can straight prevent it just by catching it early and removing it before it turns into cancer because you know where it begins.
Absolutely. And if you have a colonoscopy that was performed well, where the colon was clean, the polyps were removed, this is protective. It decreases your risk for colon cancer by 80 to 90%.
That's pretty good odds. 80 to 90%. That's almost 100. I like it. Nothing's 100, but so that's really good.
There's two parts to this. First, the patient needs to do his homework, which is to keep a clear liquid diet and to take the preparation depending on the instructions.
So you get full instructions on what you're supposed to eat, not eat. So don't eat. You take liquid, you drink liquids, kind of clean the system out.
Exactly. And that will include strained juices, broth, soft drinks, Jello. Most of these liquids, basically everything you can see through, and there shouldn't be any red or purple coloring in them.
Because then you might assume there was blood, which is bad.
Correct. Also, the preparations right now, they need to be in a split dose. That will be the standard of care. Half of the dose should be taken the night before, and half of the dose should be taken early in the morning, about 4 hours before your test, because it will clear the right side of the colon much better, and the visibility will be great.
What's up with the left side?
Left side is usually clean anyway,
okay.
Even if you take the whole prep the night before. But that's a little harder to do because most preps are pretty large volume liquids, about 3 to 4 liters, which is almost 1 gallon of fluid.
Holy moly.
And there are some other preparations which are smaller volume or pills. All of them need to be accompanied by increased fluid intake because what they basically do, they wash the pipe. And they're not absorbed, so you need to drink enough fluids so you don't get dehydrated.
Clean the pipes. I like
Correct.
that. Okay, layman's terms. Clean the pipes, drink a lot of fluids. So then what can we expect once you go in? You would find whatever you find, and then you fix it then, or you set up for an operation procedure?
So if you find any polyps and they're not extremely large or they're not a colon cancer, you can take them off right there and then. And that's the part that will basically decrease your risk of colon cancer by 80 to 90%. In case you find a very large polyp that you cannot remove endoscopically, that might need surgery. And of course, if you find a colon cancer, we take biopsies to diagnose it, and you will be referred to surgery.
Okay, so it's all step by step by step. How do we keep that colon happy? What do we do to avoid having to climb up in there and remove things?
So the most important thing is the lifestyle. If you have a good, healthy diet, that includes fruits,
Veggies.
vegetables, and grains, and decrease the intake of fatty foods and red meat,
Oh,
you're
great.
already ahead.
Really? So steak is bad?
Occasionally would not be so bad, but
Once a week? Big fat steak once a week? How's that?
well, I'm not so sure. But
Too much steak?
I would eat it.
Really? I love steak. Okay, so fish is okay though, right? Fish
Fish
is good,
is
clean,
great.
white fish, good clean fish.
Correct.
Okay. But
And-
meat is bad. Okay, I'll put that on my list. So what are the best foods we can eat? We know so we want grains, we want white fish, and eat vegetables.
Vegetables and fruits.
Vegetables and fruits.
All colors of the rainbow.
All colors of the rainbow. So the fruit smoothie would be good?
It would.
Okay, good. So probiotics is good.
Probiotics are excellent.
You like probiotics?
for general digestive health, and each bacteria has its own role. So not all probiotics are created equal. Different probiotics would do a different
A different thing for the system.
thing. Right.
Okay.
So some will help with the gas production, some will help with the immune system of the gut, some will help with the discomfort, and so forth.
Okay. Gas production. Let's back the bus up. Probiotics decrease or increase gas production?
The good probiotics will decrease the
Decrease
gut
it.
production.
Okay.
Yes.
Bad probiotics will increase it.
There's not bad probiotics.
There's not bad probiotics. Okay.
Probiotics mean that you introduce healthy bacteria that help your digestive system.
Okay.
That's the definition of a probiotic
Well, there you go. Now we're learning something else. We went off track from the colon to probiotics, but they all kind of work together because probiotics are good for your digestive.
system. Yes.
So what can you tell us? What's the number one thing we need to do to take care of ourselves?
Actually, exercise has a very important role, even for colon cancer. A good amount of exercise would reduce your risk of colon cancer by 27%.
Ooh. Okay,
So
good.
It's quite important. A good diet and exercise together will reduce your colon cancer risk by about 40 to 45%.
Excellent. So just live right, exercise and eat right, which is what we're supposed to do anyway,
Correct?
right?
Yes.
So just reinforce it. And then some probiotics. I'm just glad that my probiotics work.
And of course, the most important thing after that is to look for colon cancer, to screen for polyps, which are the precursor of a colon cancer, and to
Right.
remove them. And this, as we discussed before, should start at 50, age 50, if there are no family history of colon cancer or no diseases that would increase your risk of colon cancer, like inflammatory bowel disease, ulcerative colitis, Crohn's disease.
Yeah, none of those sound good at all. We want to avoid those. So let's exercise and do things. Now, you're developing new screening options. What's up with that? A different procedure?
Colonoscopy still remains the preferred test for screening and prevention of colon cancer. There are some other tests that are being used. The virtual colonoscopy or CT colography. It's a CAT scan test. The patients still need to prepare for a colonoscopy, clean their bowels.
Do the flushy thing.
Correct. And then their colon is reconstituted in a 3D model that will show polyps.
Oh.
Now, stool, if there's any retained stool, might look like polyps. And if there are any polyps, of course, they will need a colonoscopy.
Anyway.
Anyway.
I see what you're saying. So you might as well just get it over with and go with the colonoscopy so the doctor can actually see what you're looking at.
Correct. And we also have the added risk of radiation with the CT colography. So we don't like that part very well.
Okay, I've learned something here. I need to just buck up and go for it.
I think you do.
That's
I think
it.
you do.
There's no way around it. Thanks for pointing that out to me. So how can people reach you?
I am currently located in St. Helena, 821 South St. Helena Highway, in the medical specialties office, suite number 2. And our phone number is 7